not a stranger to the dark. Hide away, they say, 'cause we don't want your broken parts. I've learned to be ashamed of all my scars. Run away, they say, no one will love you as you are. But I won't let them break me down to dust. I know that there's a place for us, for we are glorious. When the sharpest words wanna cut me down, I'm gonna send the blood, gonna drown them out. I am brave, I am bruised, I am who I'm meant to be. This is me. Look out, 'cause here I come, and I'm marching on to the beat I drum. I'm not scared to be seen, I make no apologies. This is me.
Good afternoon, everyone. My name is Larry Buie, and thank you so much for tuning in to my incoming HOPA President remarks. I am so sad that we are unable to be together because of COVID-19 and everything that has happened due to this pandemic. But rest assured, we will all be together again very, very soon. I do want you to know that it is with extreme gratitude that as I stand before you as the next HOPA President. Before I go any further, I do want to thank all of the HOPA heroes out there that have been serving on the front lines of this pandemic, taking care of our oncology patients. Many of you have been redeployed. Some of you have been working in vaccines clinics or administering vaccines. And unfortunately, some of you even had to be furloughed due to the economic fallout associated with it. I do want you to know that I thank you for all that you've done. HOPA thanks you for all that you've done, and the profession thanks you for all that you have done for oncology patients during this pandemic. Now, I know that a lot of you were probably thinking Larry's going to be the president. He'll have a Beyonce song, and certainly there were many that I was contemplating. However, I chose This Is Me because This Is Me from The Greatest Showman is a song of resilience. We have just undergone an unprecedented time in our history, and this song helps us with hope to move forward. It also allows me to talk about some of the barriers that I've been able to overcome and some of the victories, the personal victories that I have made. So sit back and indulge me as I share with you my journey of gratitude, stopping along the way to thank those that have been very instrumental in my development as a clinical practitioner. So I think everyone can tell whenever they hear me talk, right, that I'm not from New York originally. I'm actually from Eastern North Carolina. And due to reasons that are beyond the scope of today's presentation, I'll just say I was placed into a group home called Barium Springs Home for Children when I was 16 years old. Now, in this preparation for adult living program that I was in, I did go to high school. I had to work a job, so my first job was at McDonald's. But it was also an opportunity for me to meet social workers like Donna Forte, who challenged me to be my very best every single day, even on days when that was extremely difficult. I can tell you without doubt that there is probably no way I would be standing before you as HOPA president. I don't know that I would be a pharmacist. I don't even know if I had gone to college if it hadn't been for Barium Springs Home for Children and people like Donna. In fact, Donna moved me into Morrison Dorm my freshman year at the University of North Carolina at Chapel Hill. Now, whenever I started in undergrad, I was certainly marching to the beat that I was drumming. I was following my interest, and that started in comparative literature. In comparative literature, I also had to have a Romance language, and so I was studying French. And I was fortunate to be able to do a summer at the Sorbonne and a year at Paul Valéry in Montpellier, which is in the south of France. I had put off all of the science classes that I needed to graduate until the very end. So whenever I got back, it was time to pay those dues. I enrolled in Biology 11 and loved it. So it only made sense that whenever I combined my literature interest with Romance languages and some science, that I would go to pharmacy school. And it was immediately upon entry into pharmacy school that I was able to meet and interact with so many different mentors. One of the very first people that I met was Carla White. And I remember sitting there in orientation, listening to Carla, talking about all of the things that pharmacists were able to do. Things, honestly, that I just hadn't even imagined. Carla would go on to recommend me for the Joseph Hollingsworth Scholarship Program, which I participated in, and I was able to interact with others such as Tina Brock and Joellen Rogers, pictured here. In fact, I'm pretty sure that Joellen gave me my first lessons in oncology. Joellen is a cardiology pharmacist, and I specifically remember her teaching me about HER2-directed therapies and emerging cardiac toxicities with trastuzumab. This all made me want to complete residency training, and I participated in the Clinical Scholars Program at UNC, and you can see my class here, and that was led by Joellen Rogers and Susie Kayla. And Susie would go on to become my mentor during residency training. Now, I did stay at UNC as a PGY1 and PGY2 resident, and I also completed an oncology fellowship at the Eshelman School of Pharmacy. Now, we worked hard and we played hard, and you can tell by some of the pictures on the slide that I was the brunt of several jokes from my residency class, but they were a fantastic group. I think if you look closely, you'll see several oncology pharmacists in there, many of them HOPA members, and in fact, Helen Marshall is a prior member of the board of directors. I do want to stop and thank all of those that have been instrumental in my development as a researcher, clinical practitioner, residency program director, and oncology pharmacist. So I'm going to start with John Valgas, who is my RPD. And not only did John teach me to use an evidence-based approach when taking care of patients, but John also taught me about mentorship and how important it was to always pay it forward. To pay it forward to those that I was training and teaching, and to pay it forward to the profession. Then there was Kamakshi Rao. I met Kamakshi when I was a fourth-year student. She was just starting at UNC. And I finally had the opportunity to be on rotation with Kamakshi and interact with her as my PGY1 residency coordinator. I saw Kamakshi practicing at the top of her license, and I wanted my practice to emulate hers. And she really planted in my mind that I would become a hematology pharmacist. Beth Chen was actually able to teach me about being accountable to my patients and gave me an understanding of what it was like to be responsible for their care. I won't ever forget Beth asking me one day about a PCA setting for a patient. And I didn't have all of the information that I needed to sufficiently answer her questions. And so I became frustrated, and I apologized to Beth. You know, Beth, I don't have the answers. Beth said, "You don't need to apologize to me. If you're going to apologize to anyone, you should apologize to the patient." And from that moment on, I believe I had everything that I needed to answer questions regarding a PCA. And then finally, there was Celeste Lindley. And Celeste was a brilliant mind, and I was one of her last fellows. But I can say, out of all of the topic discussions that I've ever had, no one could do a topic discussion like Celeste Lindley. So then I launched my career. I started a little bit further south at the South Carolina College of Pharmacy, and my position was actually at the Medical University of South Carolina in Charleston. And this is where I got to work with greats such as Philip Paul, but also interact with my friend Leanne Norris, who I would go on to serve on the board with later at HOPA. It was also where I had my first resident, and many of you recognize John Bazar. And for those of you that maybe don't recognize him, you probably definitely have heard his voice. He is the voice of OncoPharmPod, and if you haven't listened to that yet, it's definitely worth it, so check that out. After a little over a year at the Medical University of South Carolina, there was a position that opened up back at UNC, and I thought, well, it's time for me to go back home. And this was actually one of the best professional decisions that I've ever made. I was working in bone marrow transplant and hematologic malignancies at the Medical University of South Carolina, and this was going to be an opportunity for me able to go back to UNC and to rotate between hematologic and solid tumor malignancies with my inpatient partner here, Jill Bates. Jill and I were actually able to partner with the Eshelman School of Pharmacy under the leadership of Scott Savage, pictured here, as well as Raul Daniels, my director of pharmacy, and Stephen Eckel over at the School of Pharmacy to develop a partnership in patient care with a layered learning practice model. So with this, Jill and I were able to create from the ground up a layered learning practice model using residents and students in different ways to be able to achieve national patient safety goals and other items. So not only, though, did we improve the quality of the care of the patients that we were taking care of, we also studied this model and found out how we were able to use it to reach educational objectives as well. I think most importantly, the layered learning practice model allowed all of us to focus on the development of the pharmacist-patient relationship. Finally, I was around 40 years old, and it wasn't really a midlife crisis, but I did know that I needed to do some things differently. I thought about going back to school. I thought about selling my house and getting a new one. I thought about replacing my car, and I loved my car. I had a Seafoam green Camry, and I thought, well, maybe I'm of an age I need to trade it in for something a little fancier. I just got new tires on my car, but again, I did know that change was due. And so I called Nellie Adele on the phone, who was a clinical pharmacy manager at Memorial Sloan Kettering, and told her about my interest. And she was like, Larry, come on up. And so I was able to come to Memorial Sloan Kettering and join the leukemia service, where I was able to work with fantastic clinical pharmacy practitioners, as well as leaders in the field, such as Martin Tallman and Ellen Berman, pictured here. We had a great time taking care of patients, and I will say I am very, very thankful for all of the patient interactions that I've had, not only at MSK, but UNC as well as MUSC. It has been a privilege of my lifetime to be able to care for them, and everything that I learned from one patient, I did try to use to make the care of my next patient even better. Finally, I do want to thank my MSK colleagues as well, so my manager, Ricky Tizon, as well as my colleagues, Stephen Harnaker and Sherry Matthew, who I work with on a daily basis. I'm managing our clinical pharmacy specialists. My current role as clinical manager of bone marrow transplant, lymphoma, and multiple myeloma clinical specialists, in addition to being the RPD. I also want to thank Scott Frieswick, who is our Director of Pharmacy and Chief Pharmacy Officer, who allows me the opportunity to be able to work at the level I do for HOPA every single day. And I do have to thank all of the residents that I've trained. Many of these faces are familiar. You've even seen some of them presenting at these conferences. And in fact, you just heard from Binyam Molina and Maurice Alexander. And not only have they been able to talk about the impact of race and health disparities, but they also taught me important lessons like pre-rounding from home, something I thought, why would anyone ever do that? But then fast forward 10 years, a pandemic happens, and it's actually a really good skill to have. So thank you, Binyam and Maurice, for that. And to all of my recent residents where I've been able to serve as RPD, I hope that you'll remember the lessons that I learned from John, to always pay it forward to the profession, to HOPA, and to your patients. So a little bit about my story before I go into my plans for next year with HOPA. I really started in HOPA during my training at UNC. I joined as a PGY1 resident, and at UNC we were always taught to make sure that we were participating in our pharmacy organizations to keep the profession moving forward. I was passionate about pharmacist education, and that was the path that would ultimately lead me to serving on the board of directors. I started out in standards and education with Sally Barber as chair, a current member of our board of directors, and then I moved to annual conference programming, where ultimately I served as chair. I had a small stint on educational development and then was elected to the board of directors, where I was able to work with all facets of oncology education, materials for pharmacists, and also develop some of our first initiatives within global health. And again, it is really an honor of a lifetime to be able to serve as your next HOPA president. I have to thank David and the 2021 board for what has been an amazing, amazing year. David has been able to lead us through a pandemic and everything that has been happening at such a rapid race in the profession of pharmacy. And he has been also able to do that while we were changing management companies. In fact, we have seen the launch of educational programs that have become profitable for the very, very first time. So thank you, David, for your leadership. And thank you, everyone on the 2020-2021 Board of Directors, for all that you have done to raise the bar of our profession. Unfortunately, this is always the time of year where we have to say goodbye to some folks that are on the board of directors as well. So this year we'll be losing Susie Lever from Nebraska Medicine, currently now at BMS. We'll also be losing Sally Barber who was our secretary that works at Duke University, and Jeremy Welling will be leaving us. He was an at-large member that did work for Prime Therapeutics, but is now with Genentech. So a 3-year term or more is a long time for everyone to be on the board of directors. It is a lot of hard work. So if you see them, thank them for their service and all that they have done for HOPA and for our patients and for our profession. So before I get into my particular vision, I want to remind us of our mission and vision statement. So we are pharmacists optimizing cancer care, and we accomplish that by supporting pharmacy practitioners, giving them the tools and resources that they need in order to take the best care of individuals that have cancer. Our vision seems simple, that all cancer patients will have a pharmacist as an integral member of their healthcare team. And that is challenging, friends. And it takes all of us to ultimately be able to make that happen. What we do know as well is that the care team continues to expand, including people today like specialty pharmacists and community pharmacists as well. So who is HOPA? Well, we're over 3,800 members now, and every year that membership number continues to grow. We have representatives from academia, investigational drugs, community pharmacy practice, community and academic medical centers, as well as industry, and many, many trainees. One of my first goals for next year is to continue to expand HOPA's reach. We have developed a task force on student engagement to look at how HOPA can collaborate with schools of pharmacy so that we are able to teach pharmacy students about oncology even earlier in their careers. Again, we want HOPA to be the professional home to all pharmacists that are taking care of patients with cancer, and that includes people like specialty pharmacists and investigational drug pharmacists, or pharmacists that may be working in more non-traditional roles, such as those with pharmaceutical industry. We want to understand all of their needs, and we want to be able to provide them with the resources that they need to also perform in their roles as well as they can. We will continue to increase our external collaborations. We now have over 40, and these collaborations are really important whenever we think of patient advocacy and moving the profession forward. Clearly, coming out of COVID-19, our profession is going to be much different. We have gained access to a lot of rights as pharmacists due to the public health emergency, and we want to make sure that none of those are rolled back after COVID is over. Finally, our patients have become, HOPA itself has become more patient-facing, and we want to continue to do that. We want to use patients to tell their stories of their interactions with pharmacists so that everyone will understand the role of the pharmacist on the healthcare team, and patients will know that we are indeed there. The second goal area that I have is regarding HOPA's commitment to diversity, equity, and inclusion. David has already talked about the survey results that we had from earlier in the year, and it is clear that at least 50% of our membership believes that diversity is valued at HOPA. I think clearly when you look at our board of directors and our committee leadership, it definitely doesn't reflect the diversity of our membership, and we need to make changes to improve that. We've also learned that race, age, gender, and other factors can affect perceptions about HOPA, how much opportunity there is in the organization, if there really is a chance at equity, and how much trust there is within our group. And so we want to be able to move the bar on those things. So how will we do that? Well, the board of directors is already meeting to develop a DEI statement. A task force is being assembled to tackle diversity, equity, and inclusion, and their goal is really going to be able to incorporate strategies into our current strategic plan. Some of the overarching goals of this group is going to be to increase diversity in our leadership, which could simply be measured by looking at our committee leadership as well as our board of directors and see how that's changing. We also want to be able to develop tools and resources that can be used to take care of diverse patient populations and help pharmacists taking care of them. This may include things like cultural competency training. And finally, we have heard from Dr. Lakeisha Butler during our keynote talking about structural racism in pharmacy and how to dismantle that. We actually want to understand better the disparities that exist in healthcare and the role pharmacists can play. And so ultimately, we will want an annual report of some type that we will be able to use to measure our progress in the DEI area. Ultimately, our goal is one of inclusive excellence, where everyone within HOPA can thrive. This is our professional home, regardless of ethnicity, race, sexual orientation, or age. And then my third goal area is to develop the HOPA Collaborative Research Program. I think many of us have gone to resident poster presentations where we have looked at small numbers of similar projects that have been done in many institutions, and we thought to ourselves, wow, if we could only pull some of this information, it would be so much more valuable. And then we probably lose 2/3 of those projects because they're never published. So with this HOPA Collaborative Research Program, we would need to develop an infrastructure for research. We would need to identify funding partners and develop tools and resources so that we could support those that were actually doing the research. We want to use this as a way to promote pharmacist-led research, improving quality, and the ability to research difficult scientific questions. We ultimately want to be able to use this framework to show the value of the oncology pharmacist and develop standards for HOPA. Our first go at this is going to be the Oral Chemotherapy Collective, which is being formed right now as we speak, and there are volunteer opportunities that await all of you in this area. This collaborative is going to bring together the best in oral chemotherapy, research, advocacy, as well as quality, all to the same table so that we can create this collaborative framework and produce the best practices for HOPA that can be used across the country and across organizations with HOPA as the leader. So how are we going to accomplish all of this? Well, we do have a new board of directors, and it is my pleasure to introduce them. Heidi Phoenix is joining the board again from Mayo Clinic, and Heidi is going to be the president-elect next year. Also joining the board is Amber Lawson from the University of Kentucky, who will be our secretary, and Andrea Iannucci, who is joining from UC Davis as an at-large member. Returning members next year include David DeRemer, who will be our past president, Patrick Medina, who will be our treasurer, and at-large members Leanne Kennedy, Emily Mackler, and Lisa Davis. I also want to make sure that we thank our HOPA staff. Our HOPA staff is a group of now greater than 20 employees that work for Executive Director Incorporated, with Ann Krolikowski serving as our Executive Director for HOPA. We look forward to working with them, and with this full staff, we should really be able to enhance our volunteer experience as well. And finally, I do have to thank the HOPA warriors, all of our volunteers within our organization that work so hard to take care of cancer patients and move our profession forward. To all of you that have served in committee leadership, thank you so much for your service. Members, thank you for participating. And this is not only a thank you, but a call to join us again next year. We do have a new governance structure. We are looking at ways to continue to optimize the volunteer experience. And again, with all of the staff support that we have now at HOPA, we think it's going to be a much better experience. The Volunteer Activity Center is open. It's open until May 3rd, so we encourage you to go look at all the different offerings. I've got 2 large initiatives that are in there now, the DEI initiatives with that task force, as well as the collaborative, the Oral Chemotherapy Collaborative, where we are looking for folks just like you to join. And remember, we do absolutely need your help. We can't do any of this on our own. I told you at the beginning that I was hopeful that we would all be together again very, very soon, and so I do want you to save the date for our fall practice management meeting. This is going to be held on Thursday, October 7th in Washington, D.C., and it will be a one-day event with 2 tracks focused in investigational drugs, and specialty pharmacy. Now, this is going to be a little bit different. We are hoping to use these tracks to identify problems and come up with real solutions in these areas, so stay tuned for more information. And finally, I want to thank my husband, Joe. Joe has been with me the whole time that I've been on the board of directors, and we were able to be married in Maine in 2019, right before this pandemic got started. You know, I just want to thank Joe for always being there. A lot can happen in a lifetime, and I can tell you, whenever I was 16 in that group home, I never would have thought that I would be able to marry the man of my dreams. So thank you very much, Joe. And with that, I want us to all keep reaching for the sun. Thank you very much.